it right. Everybody will be dancing and we're feeling it right. Everybody will be dancing and be doing it right. Everybody will be dancing and we're feeling alright. Everybody will be dancing tonight, doing it right. Everybody will be dancing and we're feeling it right. Everybody will be dancing and be doing it right. Everybody will be dancing and we're feeling alright. Everybody.
Hey guys, it's your girl, Brittany, here to bring you my asthma presentation. I'm so excited to present this to y'all. Worked really hard on it, so I hope y'all are excited. Take some notes, and I hope y'all take away a bunch of cool little things y'all didn't know already about asthma. Let's get started.
Okay, so let's go over the definition of asthma. It's a common lung disorder in which inflammation causes the bronchi to swell and narrow the airways, creating breathing difficulties that may range from mild to life-threatening. And in the picture above, you can see a constricted bronchi. You can see the muscle, the red bands constricting, and a little bit of edema seeping out. Okay, etiology. Risk factors for asthma. You have two of them, host factors and environmental factors. We'll discuss environmental. That's going to be the more common one. Allergens, domestic mites, furred animals, cacaroches, infections, occupational sensitizers, tobacco smoke, outdoor, indoor air pollution, also cold air, and diet. All of these are going to cause somebody to have asthma. And now that we've discussed what causes it, pathophysiology, what's going on in your body now that we know that you come in contact with one of those triggers. On the left of this picture, you can see a normal person with some normal airways. And then on the right, you can see an asthmatic person coming in contact with their trigger and reacting to it. They got the narrowed airway, tightened muscles, inflamed, thickened airway wall. You got some mucus. It's all there. It's all there, y'all. But on the next slide, we will further discuss what's going on in the body. When a patient inhales or ingests an allergen to which he or she is sensitized, the antigen cross-links to specific immunoglobulin E, IgE, molecules attach to the surface of mast cells in the bronchial mucosa and submucosa. And in this picture, it's small, but you can see the mast cell, the IgE antibody and receptor, and an antigen coming in contact. But on this next slide, it'll have a much bigger picture. We will actually see where the mast cell is going to degranulate and do what? It's going to release multiple mediators, including the SRSA, histamine, PAF. Y'all know them. Why? Because Bob says we got to know everything. So we know all of those mediators. And here's an even bigger picture of what's going on and more confusing because I love y'all. Duh. So on the top left in the middle, you have that red. It's the mast cell, and it's degranulating, releasing those mediators, causing an acute response. You got your bronchospasm and your edema. So what do? You take your bronchodilator, step, and you're good. But later you have a late response. You got airway inflammation, hyperresponsiveness. That's caused by an increase of eosinophils and IL-5. So there's a lot of things going on in the body, that can be life-threatening. Symptoms, you got your cough, your wheezing, shortness of breath, chest tightness. These are going to be happening during an exacerbation. And sometimes, you got somebody who's less severe, and it's just going to happen when the weather changes, when the seasons change, and all that good stuff because they're lucky like that. But, other people, they might be having an exacerbation, come into the ER, you're going to see all of these symptoms. And you're not going to need to auscultate them. Put your Littmann away, you'll be able to hear them wheezing from across the room. It will be very audible. So, how is asthma diagnosed? How do we differentiate asthma from other lung diseases, other obstructive lung disorders? How is that? How can we diagnose somebody? You got your pulmonary function test, PFT. All right, and everybody's gonna have to take one if they have a lung disorder, of just what I was talking about. But it's the results that are gonna differentiate them. A PFT, records how much air you blow out. FVC, and how quickly you do it. FEV, you got your ratio. Y'all know what's up. You know what I'm talking about. Your score is lower if your airways are swollen or constricted because of asthma or other lung diseases. You might have spirometry before and after you take medication to see if the medication helps. If you are responding really well to bronchodilators, that is a big marker as to if you're an asthmatic, because other lung diseases, people who have COPD do not respond as well to bronchodilators as asthmatics do. It's not that they don't respond at all. So here's the treatment. You got your SABAs, which is going to be your pro air, something you should carry all the time because you don't know when you're going to come in contact with the trigger. Inhaled corticosteroids, long-acting beta agonists, your leukotriene modifier, anti-IgE. Those are all going to be long-term medications, something you need because you're having symptoms more than twice a week, more commonly. You got those are going to be inhalers, the inhaled corticosteroid, long-acting beta agonists. Leukotriene is going to be a pill. You got your Montelukast, your Singulair, and anti-IgE, which is going to be a shot, which is going to be your Xolair or your Nucala. And you will not be prescribed all of these. That would be, somebody who's extremely severe. You may only need one. You may only need two. It's going to be determined by your doctor how responsive you are, and you're going to be doing follow-up visits. It's going to be the results of your PFT. If you're not doing so well and you already have, your inhaled corticosteroid, give her an LABA. Here is a chart of a large majority of the inhalers. You got your Pro Air, your long-acting beta agonist, your inhaled corticosteroids. Like I said, it's going to be long term. It's somebody who's going to be, has exacerbations. And you have your combination medications, which is going to have two of those together. And if you're prescribed these and you're still exacerbated, that's when you're going to get the leukotriene modifier. That's when you're going to get the anti-IgE, because you got high levels of that IgE that we discussed earlier. But yeah, that's pretty much everything. I really hope y'all enjoyed this presentation as much as I enjoyed making it. If y'all have any questions, raise y'all's hands. Peace.
Doing it right, everybody will be dancing and we're feeling it right. Everybody will be dancing and be feeling it right. Everybody will be dancing and we're feeling alright. Everybody will be dancing tonight, doing it right. Everybody will be dancing and we're feeling it right. Everybody will be